School, of course, back in full swing here in the Metro, which also means back to school sports. And while there are numerous benefits to participating in these great programs, there's also that opportunity for injury, too. So today we have an emergency physician here with us from Belton Regional Medical Center. Dr. Stefanie Shustek can discuss how you can prevent your athlete, hopefully, from visiting the ER in an ideal world, right? Thank you for joining us.
Thank you for having me.
Okay, so what's your big message to parents, would you say? Your best advice?
My best advice is preparation. Prepare your child in advance. First and foremost, get a physical. Start with a physical from a provider, thorough heart exam, lung exam, because you want to make sure that, especially in the heat, twice a day training, if they do that, that you have the capability to do the stamina to keep up with that.
I wanted to talk about heat for a second. Are you seeing a lot of issues? Obviously, on a cool day like this, we tend to forget about it.
Sure.
But have you seen over the summer months a heat problem?
We have. We've seen quite a bit of heat stroke, heat exhaustion in both children and adults. Children especially, because they have a very low threshold for heat. So they need to stay hydrated throughout the day. There are recommendations that we've talked about, how much water and Gatorade and how much sports drinks they should drink while training.
Yeah, I got to keep it coming. Yeah. All right, what else do you suggest to parents then? I interrupted you.
That's okay. Definitely train not alone. Definitely train with a trainer, and do a training program with a certified coach or trainer, because you want to be able to do endurance and strength training together. The benefits of training with a trainer, of course, are not doing things wrong or incorrectly that will promote injury. So those are very important.
So let's talk about that big C word that's going all across the country still today, and that is the concussion word. Boy, what can we do better as parents to help prevent that?
Sure. Definitely there's stuff you can do before your child gets a head injury. There's pre-concussion testing, which tests balance and cognitive abilities, so that way you have a baseline if your child does get a head injury.
Something to compare it to.
Exactly.
Okay.
When they do get a head injury, if they do, they can see their progress in improvement and healing. Because the brain, it doesn't necessarily have to have a direct hit. It could just be kind of like a whiplash back and forth. It doesn't necessarily have to have a loss of consciousness or passing out. It could just be the impact of the head itself.
Do you have any good advice? I've often heard parents, something happens on a Friday night on the football field and they wait and they wait, and then they kick themselves the next week because they really think they should have probably gone to the ER that night. How do you know?
Sure, you never know. The best advice I can give you is call your doctor. If you have questions or see any kind of behavioral abnormalities, vomiting, excessive sleepiness in your child, bring them to the ER. Lots of times parents will wait. I myself wait.
I know, we all do it.
We all do. We all wait. And the most important thing is to notice any differences in your child.
All right, great advice. Doctor, thank you so much
for
stopping by. For more from HCA Midwest Health, go to kctv5.com and click on our Health tab.